My route, my journey to becoming a board-certified plastic surgeon is a little different. I really went into medical school with a headset that I was going to become a pediatrician. And interestingly, as I went through my first 2 years of medical school and had my first exposure in New York City to pediatrics, I was wildly disappointed, mainly because I was in a very kind of a highfalutin medical center where only the professors were allowed to, only the mothers would allow the professors to see their children in the pediatric clinic. So I really didn't have that hands-on experience, and it really disappointed me. But there was one little boy on our service at New York Hospital, Cornell Medical Center, that was actually a child from Colombia, South America. And he was on a special program who had come up because he had a cardiac defect. So he came up really without family, all on a charity basis to our hospital, and he was going to have heart surgery by our very prominent heart surgeons at New York Hospital. He was on our pediatric service. I had a chance to be his doctor, if you will, his student doctor, because he really wasn't assigned, one of the luminaries, though he had great care all around him. And I got a chance to go to the operating room to watch his heart surgery. In fact, they even gave me a retractor to hold, and the whole thing was a new exposure for me. So it completely changed my perspective on caring for children and gave me a surgical slant. So at that point, I thought, well, I'm going to be a pediatric cardiac surgeon. From there, I went on. I finished medical school. I decided I needed a full training in general surgery to get into cardiac. Did that at UCLA, a 7-year program, which included 2 years of cardiac surgery research, which also got my excitement going for the nature of cardiac surgery. But interestingly, during those 2 years, I had a lot of focus on the fine-tuned surgery of cardiac surgery, transplanting veins to create arteries to replenish the blood supply in the heart. And it was really then when I realized that I wasn't sure that I wanted to devote my career to basically at that time in the 80s, patching up hearts of generally older people that had a sort of a life of not taking care of themselves, really kind of buying time for them, as opposed to my fascination with, again, children and that fine-tuned surgery. So when I finished general surgery, I decided to go into plastic surgery with the express intent to becoming a microsurgeon. And in this way, being able to work on all sorts of problems in a very positive, reconstructive light, and people of all ages, particularly children. So that's really how I became a plastic surgeon, was via pediatrics, then cardiac surgery, and then finally microsurgery, plastic surgery. When asked about what my most memorable moments are in plastic surgery, one of the reasons I'm so thankful for my life choice about being a plastic surgeon is that I have this Groundhog Day of fulfillment every day in different ways, and they can be in momentous ways or in very subtle ways, and it really is about interaction with people. Of course, as a surgeon, we're generally dealing with someone who's asleep, but most of what being a plastic surgeon is about somebody who's awake and is being really human and really vulnerable with me and my ability to, or my privilege, to listen to them and to have their trust. So trust comes in a lot of different ways. There's so much confusion, unfortunately, on the part of the public and actually other doctors about what constitutes a board-certified plastic surgeon. Because these days there's so many cosmetic surgeons and that whole general rubric of cosmetic surgery that makes it very confusing for people to understand what qualifications are involved. Probably the best way to know whether someone is a board-certified plastic surgeon is to ask them during a consultation, "Doctor, I understand that you perform these procedures here in your lovely office in your surgery center, and that's where I'm having my surgery. But were I to decide to have the same procedure done in a hospital, would you have privileges in the hospital to do this procedure?" Because that question gets down to the crux of whether someone is board certified in plastic surgery or not. In terms of some of the new and exciting areas in cosmetic surgery, one of the areas that I'm very involved in, that I'm so committed to, is the whole world of transgender surgery. It's interesting how, although I've been trained in this long ago, this has really come to the forefront just through a lot of social consciousness expansion, political activism. Many of the procedures that I've been doing consistently throughout my practice now suddenly are covered by insurance. Our patients are, we live in a very rich environment here in Washington and Seattle, where patients are very proactive about themselves and about their gender identity. So we've had a great opportunity to be very involved with that. And it represents a great opportunity for us to have direct communication with that person. That's one of the things that I enjoy the most, really understanding where somebody is in their journey and how to be a small part supporting that. It's always a little bit of an awkward question when asked why should people come and see us here at Partington Plastic Surgery over other surgeons, because certainly we're very blessed to be in a very rich community of well-trained people and highly respected colleagues. I think that great value that people have when they come here, that they perceive, is that they see the benefits of experience. Here I've been in practice for 25 years. Also, I think it's because we make a big point here, all my staff, which I'm very proud of for this very reason, that we've all got good heart, we've got compassion, we want to listen, we want to understand, because we know that in medicine the most important thing to getting the right outcome is to really understand the diagnosis well. And the diagnosis in plastic surgery all comes from people being comfortable and being able to communicate what their hopes, their dreams, their fears are. And if we can be good listeners, which we are here, we really have that first step in getting it right. I think the thing that triggers a smile most quickly for me is that wonderful opportunity, that wonderful moment when I'm in the presence of one of my dear trusted patients who is now post-operative, has gone through the process, gone through all the concerns, the fears, all the anticipation of surgery, has done a great job with healing, and then has that special moment when they're in the exam room and it's their first post-op visit, and they can look in the mirror and focus in the mirror and then suddenly smile. And that smile is so contagious. And when they then turn that smile toward me and to my staff with a big smile and a big thank you, that is what makes us smile most. And certainly if you have any interest in reaching out to us, please don't hesitate to contact us through our website and email at info@partingtonps.com, or call us directly here at 425-883-2294.